Hello and welcome to Unstress Health. My name is Dr. Ron Ehrlich. Well, today we're diving into a fascinating and important conversation about the connection between what we eat, how our bodies function, and how our minds feel. I mean, mental health is a huge and growing problem, conservatively affecting over 1 billion people in the world. But, this is a question of degree. My guest today is Dr. Matt Bernstein. And Matt is a psychiatrist, an educator, and the CEO of Accord, which is a groundbreaking residential program that's pioneered a more humane, effective, and holistic approach to mental health treatment. Now, Matt has a unique perspective. Not only does he draw on some cutting-edge research in nutrition and psychiatry, and those two terms have not often been connected, but how exciting to see that actually happening. But through his own personal experience with his own family, he's drawn on that to shape his work. He's passionate about showing how food can be medicine, how dietary interventions like a ketogenic diet can help treat conditions like depression, anxiety, even severe and even more severe mental illnesses. In fact, as he talks about in this episode, treats a whole lot more than that. So today we're going to be exploring how metabolism, and that's a word that's come up a lot, metabolism, metabolic health, mitochondrial function, and mental health are connected. This science behind ketones and brain health, and what practical steps we can take to better support our mental well-being through not just nutrition, but circadian harmony, exercise, and mindfulness experience. So sit back and enjoy this episode. I hope you enjoy this conversation I had with Dr. Matt Bernstein. Welcome to the show, Matt.
Thanks for having me.
Matt, as I was saying before we came on, when I got the invitation, the suggestion of you joining me, I jumped at it because this whole idea of food as medicine, and particularly this approach to mental health, is so important and so lacking, I believe. But I'm interested to know your own personal journey. What inspired you to connect nutrition and mental health? Because psychiatrists are not renowned for looking at diet.
Very true. Yeah, that's very true. It's sort of, there's a lot of versions of this story, some long, some medium, some short. So I guess I'll start and we'll see if we want to get deeper into it. But,
okay.
I was always an open-minded psychiatrist, always focused on trying to get people to their best level of functioning as opposed to just reducing symptoms, which is really what the field of psychiatry is geared towards. All the randomized trials are all about lowering symptoms on a rating scale, which is not what people really care about. People care about, can they get back to their life? Can they get back to working, having relationships, living independently, whatever their issues are in their life. So I always had a little bit of a beef with my field. And then 2 of my 3 sons got very sick about 8 years ago with a very severe neuropsychiatric condition. It looked very psychiatric at first, but then we started noticing all these physical symptoms. And eventually they got diagnosed with PANDAS, which is the new term for PANDAS. So it's essentially an autoimmune encephalitis after an infection. Mm-hmm. And it took years to sort of get to figure out what was going on and how to start treating them. And they got this very, out of mainstream medicine type of treatment, which eventually worked for them. But when they were doing standard of care psychiatric treatment, they got much worse. And so
how old were they at the time?
So we have 3 boys, and at the time they were 14 and 12. We have twins who are 14. So one of the twins and the younger one both got sick right at the same time, which is also very unusual. These, happy, well-adjusted kids doing well in school and sports and music and friends. And then overnight, they literally couldn't go to school with severe OCD. It was really devastating. Mm-hmm. So that really opened my mind that mainstream medicine, my own profession, couldn't help my kids at all. And so, it also really emphasized this connection between the mind and the body, the brain and the body, which psychiatry doesn't do a very good job of either. We're just focused on anything up in the brain and fiddling with neurotransmitters, not really thinking about how it's all connected to the whole person. And my kids' situation really emphasized that, they had an infection from Lyme disease, a tick bite, so this became a systemic problem and eventually mostly manifested in brain symptoms. I'm sitting there thinking, how many of my other patients have some medical, autoimmune or infectious or exposure to toxins, all kinds of things that can happen that can eventually lead to a brain problem. And meanwhile, as my training told me, just, figure out what the symptoms are, give the right pill for those symptoms and watch the symptoms go down. But I knew already that doesn't work in many of the people that we try it on. It doesn't really produce satisfying outcomes. And there's lots of side effects with these psychiatric medications.
Mm.
So yeah, that was sort of the beginning of like opening my mind to, alternative approaches to all of this.
Well, already what you've said is the subject for the rest of our podcast almost, because there's so much to ask you about there. Yeah. We've done so many programs where, presume, how long had you been a psychiatrist until that point in time?
Oh, I think, I'd already been in practice for, about, 15 or 16 years at that point. Yeah.
Because one of our observations regularly from various perspectives on this podcast is that often the epiphany for a health practitioner comes when they or one of their family are faced with a situation that they've been dealing with their patients for many years, but suddenly it takes on a different perspective and opens their mind to alternatives. We've done so many stories on this, Matt. This is another perspective on that.
Absolutely. Yeah, I'm not surprised. That's what you learn when you get in the world of, not mainstream medicine anymore. Most people have their own story, how they got to thinking about things differently, either their own illness or a family member.
And you've mentioned two things there. One is PANDAS, or PANDAS, or PANS.
Yeah.
And the second one being the trigger being Lyme, which is a controversial diagnosis in many practitioners' lives. Just back up a little bit here and give us the PANDAS 101 story, what that actually was.
Yeah. So what that means, PANDAS was the original concept. Specifically after a streptococcal infection, kids would get an autoimmune reaction and the immune system would start attacking a part of the brain called the basal ganglia that's involved in obsessive compulsive disorder and other movement symptoms. And so there was this picture that included acute onset of OCD symptoms in a kid after a strep infection that would tip off that this is likely PANDAS. And then the concept sort of got expanded to not just include streptococcal infections, but other infections. And that's what PANS is now called. So, pediatric acute neuropsychiatric syndrome. So essentially any abrupt onset, severe neuropsychiatric condition in a child, people should be thinking about whether there was a recent infection or maybe even a chronic infection like Lyme, that all of a sudden, why is this, well-adjusted kid getting very sick psychiatrically? There's no particular reason for that. And with my kids, there was no inciting traumatic event or anything like that. And there were two of them at the same time. So it really made us start thinking there's something environmental here, most likely. Or, maybe there's something that my wife and I were doing that we didn't realize. My wife's a psychologist. We actually took ourselves to see a psychologist to say, are we doing this somehow? And, we spent an hour with him and he said, absolutely not. You're not doing this. It didn't take him long to figure that out. And we didn't really think so, but we just wanted to be thorough and be sure that it wasn't something that we were doing in our household that was causing all of this.
Wow. What a couple the two of you are, psychiatrist and psychologist. And to have then two children display symptoms of OCD. Oh my goodness.
Yeah.
This must have been, was it literally, was it a slow onset over weeks and months?
It was literally within a couple of days, kind of onset. From being happy, well-adjusted, doing great in school and doing everything to literally not being able to go to school within a week or two. It was, in retrospect, we could see some signs, maybe before that, but incredibly subtle. It really, when it happened very fast.
And the other trigger that you mentioned, which a lot of people who aren't in the health area and haven't been exposed to it, is the Lyme.
Yeah.
And can you just give us a quick one, because this is a big topic too and a very controversial one. Can you give us a Lyme 101
Sure.
overview?
Yeah, I mean, Lyme is the term that people use for an infection from the specific spirochete called Borrelia burgdorferi, sort of a mouthful, but it's a little microorganism that lives in ticks. And so you get a tick bite. This is pretty endemic around the entire United States now, but really around many parts of the world. The tick, transmits this infection, and then it can create this bullseye rash on the skin. It can create sort of a fever and an acute illness. But then this is the controversial part. It can become chronic. That's certainly what happened to our kids and what happens to a lot of people. If you ask some academic infectious disease doctors, they're going to say Lyme disease cannot become chronic. Either, you get very, very sick and you get to a doctor, or your body takes care of it and that's the end of it. And they may prescribe a couple of weeks of an antibiotic and say that's the end of it. But there are, there's an International Lyme and Associated Diseases Society, hundreds of practitioners who think differently about this disease. It's one of the biggest controversies in modern medicine, I would say. It's a huge controversy. Yeah.
Yes. Yeah. And one of the triggers for controversies in medicine, making a big broad statement here, is that if a doctor doesn't know the answer to something, then it doesn't exist.
Right. Yeah, this is a big problem in the medical
Is that a
world.
fair statement? Do you think I'm being unkind there?
I think it's not universally true, but unfortunately, it's more common than we would like it to be.
Mm-hmm.
And I think, especially, it's a common thing in younger doctors. I think even more because, we go through all this training, at least in the United States, 4 years of undergrad, 4 years of medical school, then somewhere between 3 and 7 years of residency, or even longer than fellowships. I mean, it's an incredible amount of learning. These are, really bright people who are working extremely hard, and they feel like they do understand a lot and they've learned a lot. But I think what they don't appreciate is that no one understands the mysteries of the human body. Biology is infinitely complicated. And there's so much that no one knows, not just, it's not a fault of theirs that they don't know. No one knows the answers to many medical situations because, we just don't know enough yet. And we may never know enough that, it's very complicated stuff. So yes, I think it's unfortunately truer than, we would like it to be, that doctors think, if I didn't hear about this in school, then you must be making this up, kind of thing.
Yeah. And I can understand the need for certainty. We all want certainty, but I've been a clinician for over 40 years, and I often say I only wish I knew as much as I thought I did 10 years after I graduated.
That's right.
I mean, the more you learn, the more you realize you don't know. And I think that's exciting. It's why I have a podcast and invite people like you on here to educate me, Matt. But the other thing is, and I'm interested to know, just laying down a bit of foundation here for how psychiatry works, because the DSM-5, the Diagnostic and Statistics Manual, which defines a lot of illnesses, and you mentioned, the typical approach is one of looking at the neurotransmitters.
Right.
Are there any blood tests which we can do to establish a deficiency in some neurotransmitters or an imbalance in neurotransmitters?
No.
Which justifies the prescription of these neurotoxic drugs or neuropsychiatric drugs?
No, we cannot. In general psychiatry, we can only do blood tests that are about ruling out medical illness. There's no test to say, oh, this makes the diagnosis of whether it be depression or bipolar or OCD. There's no blood tests in psychiatry. There's no biomarkers in psychiatry. And that's actually one of the interesting things about doing this type of work that I'm doing now. I feel it much more, connected to my medical training, because I'm needing to do lots of blood tests and checking biomarkers about metabolism, because that's really, where I'm working, which we'll get to. But it's much more medically focused now that I'm doing this nutritional work than when I'm prescribing medications. It's fascinating.
I think medicine, when we go through, my background is dentistry, but
Yeah.
when we went through and we studied biochemistry, we kind of, oh, thank goodness we passed that exam. We won't have to worry about that ever again.
Right.
And that just happens to be the way the body works. Tell me, with the PANDS, coming back to your two sons and this
Yeah.
journey you were on,
Yeah.
what was the traditional approach to this problem? What were the experts telling you needed to do?
Well, we did do those treatments for a while. I'm connected, and my wife is too, to very good mental health professionals in the Boston area. There's wonderful hospitals around here, some of the best, in the world. And so we were seeing great people who were prescribing psychiatric medications to them, and they were getting worse in front of our eyes. And seemingly, each medication they were on would, sometimes it would be obvious it would be making them worse. But even the ones where it wasn't obvious, we would realize, no, this one's making them worse too. And so, we eventually found someone who understood PANDAS and said, this is often the case, and it's an inflammatory brain condition. These medications will often make it worse. They don't, their brains aren't going to react the way they typically do. And that was really helpful because we realized we should be taking them off these medications and figuring out different approaches. And that's exactly what we ended up doing. They did not take psychiatric medications after that initial number of months where things were getting worse. We ended up taking them off all those medications.
So tell us what helped.
Well, we ended up finding an environmental medicine doctor who did very aggressive treatment for Lyme with antibiotics, actually intravenous antibiotics, and many other supportive treatments for the body to detoxify and support the immune system with nutrients. So intravenous nutrients, hyperbaric oxygen, and many other things that, I don't necessarily need to go into all of them, but, really, it was a very intensive program for, that period when they got the most benefit over the course of a year. They were doing intensive amounts of treatment at the same time, all at the same time.
Wow. So this process was a year long, and now they are?
It was multi-years long, actually. Yeah. They both got to the point of recovery. One of them is still just, positive trajectory in college. And the other one, had a recovery, but then got COVID and sort of had a real problem with that. And then I think really now is suffering more from, sort of typical post-traumatic stress disorder from getting well, doing all that treatment, and then getting sick again. And that was a real blow to him, thinking that the world is very unsafe because, any infection could cause him to get sick again. So he's unfortunately still sort of working his way through all of that.
Mm-hmm. But this connection between metabolism and health in general is something that is happening in medicine.
Oh, yeah.
But mental health is really what is so exciting to hear you talk about this. Tell us about the connection between metabolism and mental health, metabolic psychiatry.
Yeah. Yeah, it is really exciting. And so the story for that, in terms of how metabolism and brain health are connected really goes back to a little over 100 years ago at the Mayo Clinic in Minnesota, where a neurologist gave a child with epilepsy a ketogenic diet. And if people don't know what that is, ketogenic diet is a way of eating that's really the opposite of the standard American diet, where we're eating mostly carbohydrates, a little bit of protein, and very little fat. This flips it on its head, and you're eating very high amounts of fat, moderate amounts of protein, and very tiny amounts of carbohydrates. And that causes the body to produce these things called ketone bodies, which are another source of fuel for the cells. And in particular, they're very, very good for the brain. And so he came up with that diet, this Dr. Wilder, and he called it a starvation mimicking diet because we make ketones when we haven't eaten for a couple of days. It's one of our evolutionary adaptations to survive during periods of less food. And not only do we survive, when the ketones start being made, when we haven't had food, those ketones fuel the brain in a way that is much better than glucose fueling the brain.
Interesting.
And so he had great success with this person, this child who had epilepsy. It became the standard of treatment for epilepsy for a couple of decades until the medications sort of, came online and people got enamored with medications and they sort of gave up on this diet. But then it got revived again in the epilepsy world in the 1980s. This film producer in Hollywood had a son with very bad epilepsy, and they were going around to all the doctors, all the neurologists all over the world, and couldn't get any help with many different medication trials, sometimes 3 or 4 medications at once, which is what happens with these kids. Also what happens in psychiatry. When one medication doesn't work, we just keep adding more and more and more. And he was eventually, they found a ketogenic diet for him. He was put on it, had a complete resolution of his seizures, able to come off all the seizure medications. Seizures still didn't come back. And then he didn't have to, he, like a lot of these kids, didn't even have to stay on the diet indefinitely. After a period of time, his seizures were just gone, even if he went off the ketogenic diet. His brain was healed, literally. And we don't have many things in medicine that can heal the brain. The brain is, once it, neurons die, it's very hard to they don't, regenerate themselves very easily. And so, loss of, we used to think that, loss of neurons meant complete loss of function forever. We now know that there is some plasticity, and that's not completely true. But in terms of actual treatments that cure a brain disease to the point where you don't even need the treatment anymore, that's incredibly uncommon in neurology and psychiatry. Yet this is exactly what has been shown in epilepsy. And there's 12 randomized trials in pediatric and adult epilepsy showing that the ketogenic diet works even when the medications don't. So that's sort of the background. And then there started, case reports started coming out about 10 years ago in the psychiatric world of people with severe treatment-resistant mental illness who would get complete resolution from a ketogenic diet. And that's now been followed up with some case series, bigger studies, some pilot trials, and now there are randomized controlled trials going on in the mental health world as well for conditions like schizophrenia, bipolar disorder, schizoaffective disorder, major depressive disorder, OCD, I could keep going. I mean, the diagnoses that this works on, it seems almost funny that you could say this works for all these things, but we can add onto that list autism, Alzheimer's disease, migraine headaches, multiple sclerosis, Parkinson's disease. All of these conditions there's evidence now that ketogenic diets have some benefit in all of those different conditions. And and even things like anorexia, which you would say, oh, you're going to do a restrictive diet and anorexia. Well, there's a nice case series, and now there's actually 2 big trials going on in anorexia with ketogenic diets.
I mean, it's interesting, isn't it? Because when people hear this commonality of approach, as in a ketogenic diet, they think, oh, come on,
right?
It's going to treat everything. But actually, the way it manifests itself is perhaps the genetic component.
Right.
It manifests itself differently in different people, but there's a commonality to it, and that commonality is common through almost every disease, and that's inflammation, isn't it?
Yeah, I mean, we think inflammation is a big part of this. It's not just inflammation, though. I mean, it's also insulin resistance in the brain. That's been shown in all of these different conditions, and that goes directly to how this diet works. And also mitochondrial dysfunction has also been shown in all of these disorders. And it's also one of the ways in which ketogenic diets help health is through improving mitochondrial health. So the mechanisms make sense. And I think, what's really doesn't make sense is our, dividing all these illnesses into these different categories when in reality, that's not based on any biology. That's just based on observation of symptoms. Even the American Psychiatric Association, who writes the DSM, who, they've been, admitting since 1980 when the DSM-3 came out that we're not really looking for causes of these conditions. We're only just listing symptoms and similarities here. And so even the people who write the diagnoses say, we're not saying anything about cause here. And the reality is, the underlying cause of all of these are those things we just described. Insulin resistance in the brain, mitochondrial dysfunction, inflammation, oxidative stress, microbiome, gut brain axis dysfunction. These are common causes for all of these brain conditions.
Mm-hmm. Interesting too, isn't it? Because so many medical practitioners, people, in fact, in general, have been brought up to think glucose is our only form of fuel.
Right.
And whenever you talk about ketones, most doctors or people in the profession who aren't aware would immediately jump to the ketoacidosis
Right.
as a major. Oh yes, well, I mean, that's really dangerous, particularly if you've got diabetes. You know, your chance of the difference. But I think it's worth us just mentioning the difference between ketosis
Yes.
and ketoacidosis.
Right. Yeah, absolutely. Yeah. So ketosis is a completely normal physiologic condition that we're all born as babies in ketosis. It's the most natural metabolic state that we can have. And as long as a baby is only having mother's milk, the baby will stay in ketosis. So mother's milk is ketogenic. And like I said, it's a survival mechanism that we developed over the course of millennia, if not millions of years, to survive. And it allows us to be energetic and quick thinking and smart, even if we haven't had food for days. And if you're on a glucose metabolism, since agriculture, we're all on this glucose metabolism the last 10,000 years or so, which is a very short amount of time compared to our evolutionary history. If people don't eat, they get irritable and hungry or hangry. You certainly wouldn't survive out in the wild if that was the case. So this is our natural metabolic state, actually, ketosis. Whereas ketoacidosis is a pathological condition that happens to people with diabetes. And it means their blood sugar is very high and their ketones start going high at the same time. And they develop a metabolic acidosis, which is very dangerous. It's life-threatening. That would never happen to a non-diabetic who's not taking diabetes medications. And by the way, ketogenic diets also reverse type 2 diabetes. We didn't mention that, but
yes, that's
but
a
there's
big one.
Overwhelming evidence that that all type 2 diabetics can completely reverse their disease with a ketogenic diet.
And that, incidentally, Matt, we've done several stories with health practitioners who had for 20 or 30 years said to their patients type 2 diabetes was irreversible,
right,
until they themselves got type 2 diabetes, and then they explored, hang on, maybe there's something I can do. What? Ketogenic diet? And they're born again. Yeah. Epiphany.
Amazing. But it is. But thinking about how much proof there is in epilepsy and type 2 diabetes, do you think if someone, certainly in the US, I'm assuming it's the same where you are, gets one of those diagnoses and goes to their, primary care doctor or general practitioner, do you think that or endocrinologists or neurologists, are they going to mention the dietary, essentially, complete reversal of this disease through diet? No, it does not get mentioned. Maybe 1 in 100 it might get mentioned, but essentially the doctors assume that no one's going to want to do this challenging diet, and therefore they're not going to mention it. Instead, they'll just say these are the medications that you need to take, and it'd be good to exercise and watch your food intake, but they don't give any detail about that. And that's sort of the end of the conversation. And this potential cure never comes up, essentially.
Yeah, in fact, it goes deeper than that, because in Australia, we had the Australian Diabetes Association celebrate its 75th anniversary and put out a 10-point plan for living life with diabetes. I realised the key question there, the key word there was with.
Right.
And step number 1 was include carbohydrates in every meal and eat a low-fat diet.
Right.
Now, that has changed in recent years in Australia, I have to say. But when we're talking about a ketogenic diet, I mean, let's paint the picture. Let's lay the foundations, because people do hear about low carb, and low carb means different things to different people.
Yeah.
How do we get into a ketogenic diet? How do we approach that?
Yeah. Well, I mean, there's different ways to do it depending on how, sort of like how much you like to measure things and calculate things versus if you like to just eyeball and get the feel of it. So I'll just do the feel of it part first, and we can get into the numbers and measurements. But essentially, you're avoiding any food with simple carbohydrates. So anything with simple sugars, processed flour. So no bread, no pasta, no rice, even Starchy vegetables are not your friend. So things like potatoes or sweet potatoes, even carrots have a decent amount of carbohydrates. You wouldn't want a lot of those. In terms of fruits, most of them are also not a great idea. You can have some berries, but generally not. We want people eating a lot of non-starchy vegetables for sure. A certain amount of protein per day. I favor animal protein. It's got a lot of benefits over plant protein. That would be around 1 to 1.2 grams per kilogram of weight per day. So not a huge, amount of protein, but, not low protein, sort of moderate protein. And then the rest of the calories need to be made up of fats. And we try to get people to eat a variety of different fats. Monounsaturated fats, everyone agrees on are healthy. And that's things like olive oil and avocados and nuts and seeds and things like that. Some amount of saturated fat, it has a good role here as well. They're stable. There's actually good evidence that saturated fat is good for the brain. And then, I think polyunsaturated fats or PUFAs are controversial these days, especially if they're coming in form of refined seed oils. We would want people to avoid those. But there's plenty of polyunsaturated fats in whole foods. They're not refined oils, and those can be very healthy as well. We want people to get a good amount of omega-3s and all of that as well. So, essentially you're eating some amount of protein, you're avoiding all those carbohydrates except for vegetables, and you're eating a good amount of fat with everything. And so you have to get your pleasure from food from the fats, essentially. And you can make delicious food this way, but you have to sort of know what you're doing.
Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory Panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. Yeah. You can use the word saturated fats with impunity on this program.
Okay.
Matt, I noticed a slight hesitation there. Don't worry, you're in good company here.
Yeah.
We actually we champion, from healthy animals.
Yes.
Come healthy fats.
Absolutely.
So ethically, there's an issue here too.
Yes.
But we're on the same page, I think.
Yes.
There are 7. Is it true? There's 7 mechanisms of how ketones improve brain health.
Yeah. Well, I like to think of it in these 7 mechanisms. I don't know if everyone thinks of it exactly this way.
Okay. I was drawn to that.
We've mentioned a few of them already. So the brain insulin resistance is a huge issue. And, the key point there is that glucose needs insulin to get into brain cells to be used for fuel. So brains can literally be bathed in glucose. Someone could have just had a high carbohydrate meal, their glucose in their blood and in their brain is very high, but their brain cells are literally starving for energy if they have brain insulin resistance. Ketones bypass that brain insulin resistance because they don't need insulin to get into the cells. So you're essentially taking what, one fuel, car, like, a gas car, and turning it into a hybrid car, and you always have a battery that's on as long as you're eating ketogenic food. So that's the first mechanism. The second one is the mitochondria. This is also probably, one of the most important ones. And so ketones are a signaling molecule to tell our cells to make more mitochondria and to recycle the old non-functioning mitochondria and make new ones out of the old ones. So they sort of break it down for parts and use the parts and make a new mitochondria. So mitochondria are the energy factories in the cell, but they do a lot more than that. They're involved in the release of neurotransmitters and gene expression and resolution of inflammation. They can even decide if the cell is going to live or die. They're the first step in apoptosis, which is cell death, essentially. So mitochondria are a very important part of this story, and they're getting a huge boost from ketones. Next is that reduction of inflammation that we talked about, which is a huge factor in almost all psychiatric conditions, every brain condition, and really almost every chronic illness is inflammation. And ketogenic diets are incredibly anti-inflammatory. So that's 3. Now, the 4th one is lowering oxidative stress, which I'm sure you've talked about many times as well. People try to use antioxidant foods, but the reality is that a ketogenic diet is creating much less oxidative stress because the mitochondria are burning fat instead of burning glucose, which creates much less oxidative stress in the burning of the fuel itself. So that's a huge factor. We'll talk a little bit about neurotransmitters. We know that ketogenic diets increase GABA and lower glutamate. And this is very helpful, we know, for epilepsy, but also for the psychiatric conditions. Things like benzodiazepines, those medications that immediately make people feel relaxed. Well, that's working on GABA. So we want more GABA. That's good for recovery from anxiety, recovery from depression. And we want less glutamate. Glutamate is excitatory, and it causes this excitotoxicity if there's too much glutamate. And many of the psychiatric conditions, especially bipolar, there's very good evidence that very high levels of glutamate in those excitatory states, and that all the medications that treat bipolar also lower glutamate. Ketogenic diet does that naturally and effortlessly as well. 6th mechanism is increase in brain-derived neurotropic factor, which we can also increase through exercise, but ketogenic diets do that on its own. BDNF, as it's called, is sort of like miracle grow for the brain. The neurons all have these projections to other neurons. Each neuron might connect to thousands of other neurons. And BDNF causes more of those connections. The more connections we have, the more flexible the brain is, the better mental health is, the better that person can learn and adapt to any situation, essentially. And then the last mechanism is this microbiome gut-brain axis. So we know, how connected the gut and the brain are now through many different ways, through neurons, through hormones, through neurotransmitters. And it's mediated by the microbiome. And we know that one of the mechanisms by which ketogenic diets work for seizures is the microbiome, gut-brain axis. There's been some really good experiments about that. And so I added in as a presumptive on psychiatry too, because there's so much evidence about that axis in psychiatry. I'm pretty convinced that the ketogenic diet is working through that mechanism as well, although I can't say that one has as much evidence as some of the other ones. Yeah.
Oh, I love it. What a great 7-step thing that is. I mean, a wonderful way of understanding it.
Yeah.
It must have, the last one must have been quite a challenge when, you were going through all of that antibiotic intravenous therapy and stuff like that.
Yeah.
Not to mention all the antibiotics we've all been exposed to through our lives.
Yeah. Yeah. Actually the one benefit of intravenous antibiotics over oral antibiotics is that it does save the microbiome a little bit more, because you're not sending those bacteria killing chemicals right into the gut. Instead, they're going to the bloodstream and going and doing their thing where they should, in the brain or in the various other places where that infection might be hiding. They don't have to go through the gut to get there. And it's one of the benefits of intravenous. But yes, even still, there's lots of need for trying to take care of the gut, trying to take care of that microbiome with many different, probiotics. And, probiotics are really useful, especially when one has taken antibiotics. There's some studies showing probiotics can independently help with mental health, but they're not very strong, on their own to do that. Yeah.
The other thing that I love about your emphasis here, and it's something that anybody following any health discussion will be aware of, is this focus on mitochondria.
Yeah, absolutely.
That has been a big aha moment for the health world in the last 10 or 15 years?
Yes. And I would say that the ketogenic diet is the surest way to improve the health of your mitochondria outside of exercise. Exercise itself is, the most important thing for mitochondria. But outside of that, the ketogenic diet, I would say, is number 2 in terms of improving mitochondrial health.
Yeah. Well, I'd throw one other one out there that I think is gaining a lot of attention, and that is circadian harmony, like our relationship. If this is about what goes on in the mitochondria is not a carbohydrate transport chain or a protein transport chain or a fat, it's an electron transport chain. So our relationship with electrons from the sun and from the devices we're exposing ourselves to now is another big challenge. Where do you stand on that?
Oh, absolutely. Yeah. I mean, it's one of the pillars of the treatment that I endorse at this program Accord that I started. The 4 pillars essentially are the ketogenic diet, exercise, mind-body program of some kind that someone has lots of options, but they need to choose some mind-body practice and do it, and circadian rhythm alignment. Those are the 4 things. And we do all of that at once. And we have tremendous outcomes and results with people who are coming in with very severe mental health conditions often.
Which is, when we think about the sad food pyramid, American and Australian diet, and then we talk about ketogenesis, when we combine that with another very popular public health initiative, which is stay out of the sun.
Right.
It's really dangerous. What does circadian alignment or mean in the Accord and Elhorn? What does that mean?
Well, I mean, to me, it means we need to be in tune with the sun. As you mentioned, the sun is, we evolved with this sun in particular. We all get very powerful biological cues from the sun, especially from blue light. And so what I want people to do just, behaviorally is I want them to get up at the same time every day. I want them to, as soon as they can, get outside and get natural sunlight right away. I want them to be outside at least 2 or 3 other times during the day for a nice walk in the sun and, getting exposure. So that again will tune that clock that's in their brain. Their suprachiasmatic nucleus is holding this clock, and what tunes the clock? It's the different wavelengths of sunlight that you're getting at different times of the day. We want them eating at regular times as well, which is the probably second most powerful way to attune the circadian clock. And then we need to avoid blue light in those few hours before bed, and that means either not using your devices. Or if you are going to use your devices, you can wear these, very powerful blue light blocking glasses that are basically red lenses, and everything looks red. Or you can, there's a setting on the iPhone at least that you can, really remove all the blue light and your phone looks completely red. It's not the night shift thing, because that's basically, if it looks normal, you haven't removed the blue light. If you really remove the blue light, whatever you're looking at should look pretty red. And so, that's a big difference from how most people are living. As you mentioned, we're all living indoors, we're not getting sun, and we're looking at screens all day. So the sun does a lot for us, but mostly it's about tuning our circadian clock and getting essentially these nutrients into us that our mitochondria use for creating energy.
And you mentioned also I love those 4 steps. I mean, pretty basic, really, isn't it? What I love about this is so much of it is achievable, accessible.
Yeah,
it's not expensive.
That's right.
And it's yet so powerful. When you talk about mind-body practices, I mean, people probably know, as I know I do, I should be meditating 20 minutes in the morning and 20 minutes at night. But what are some other mind-body practices that you would encourage your patients to have?
Well, like I said, there's a lot of options here. Anything that calms the nervous system to get us into that deep rest state. Our mitochondria react to that. They respond to that deep rest state. They feel safe. And we need to make our mitochondria feel safe for them to do their job, essentially. And so that can be breathing practices of various kinds. Breathing is one of the most accessible things I find for almost anyone to be able to calm their nervous system down. And so usually I start people on some breathing practices. If they're doing well with breathing, we might try to add some mindfulness meditation. We have a couple of devices that we use. One of them is called the Heart Math device. You may have heard of that one.
Yes.
They have a lot of research on that. And it's nice because some people like to have a little bit of feedback for how they're doing meditation and breathing to see what's going on with their physiology. And it helps encourage them to keep going. So the Heart Math is a great way to do that. There's another one called the Muse, which is more of a headband that people wear. Also gives you like a neurofeedback and telling you sort of what's going on with your brainwaves. So some people like using the devices. Some people like doing it on their own. We do meditation groups or relaxation groups. In any case, we're getting people interested in this idea, and we have people wearing continuous glucose monitors as well. So
interesting.
Here's an interesting thing that happens sometimes. So people, this has happened more than a handful of times. People will come up to us and say, "What's going on? My glucose is spiking up to 150, and I swear I didn't eat anything. I didn't eat any carbohydrates. What is happening?" And we invariably will, first question, "Are you anxious?" "Oh, yes. I'm like nearly having a panic attack right now." And it doesn't matter about what, but it's the anxiety that will spike their blood sugar. So just sympathetic arousal causing an increase of cortisol and adrenaline will release a bunch of glucose into the bloodstream. And so we'll have them, we'll sit them down and say, "Let's breathe." We'll do a breathing practice. 5 minutes later, their glucose is down below 100. And that person will always appreciate the importance of their mind-body practice from that point forward, because you can see physiologically exactly what's going on when you're wearing that glucose monitor. And it's just another reminder of how connected the brain and the body and the metabolism, it's all one system in the end.
Yeah. Well, I love everything you've presented here, and you've been on this amazing professional and personal journey that's brought you to two initiatives that you've got here, the Accord Group and the Elhorn Group. Can you tell us a little bit about these two facilities that you're associated with?
Sure. So Ellenhorn has been around for much longer. Ellenhorn's we're having our 20th anniversary later this year. And it's a program that's considered what's called a PACT team, PACT. It stands for Program and Assertive Community Treatment. And essentially what that, it was invented to when the states were closing the state hospitals in the US, and I'm assuming in Australia as well. There were these big state hospitals that used to essentially warehouse people for many decades. They started off actually with a good intention. They were considered, good treatment. They would have people work on the farm and they would take care of them. It was almost like a family atmosphere, but eventually they became these horrible institutions where people were on high doses of medications and essentially, chemical straitjackets and terrible care. And eventually the states decided they wanted to close all these, but they needed to discharge everyone. What would they do? So they created these PAC teams, which are essentially a whole team of clinicians, a doctor, a nurse, and social workers and rehabilitation counselors, and they would all work together, but they would work with these people in the outpatient setting. So as a way to really provide high level of care for people with a serious illness out in the community. And they showed that they could keep people out of the hospital and have more independent success living on their own, working, relationships, all of those things. But then they found out it was just as expensive as the state hospital. So the states didn't want to keep doing it. And so Ellenhorn is a private version of that, essentially, where we're getting people back to living their lives who had been hospitalized multiple times and really having a hard time with their illness. And the focus is on this psychosocial rehabilitation, essentially using the connection to work and relationships and independence as sort of the medicine in many ways. So we have a team around people and do whatever it takes to get them back out in the world and living their life again, often reducing psychiatric medication and trying to get them to do some of the principles that I've been describing in the last couple of years as well, with the metabolic and exercise and all of that. Accord is really just focused on the metabolic treatment, essentially. So we have people come for a month to 3 months to a house outside of Boston, and they get those 4 pillars that I talked about with the diet, the exercise, and mindfulness and circadian rhythm alignment all at the same time, with lots of measurements, with ketone measurements and continuous glucose monitors and lab work. And we even have a machine that measures body composition. And we're measuring all these mental health rating scales and seeing incredible improvements in just this short period of time. And the goal is to teach everyone how to do all this stuff so that they can keep going with all of it when they get back home. So we have a lot of teaching of metabolism and how to construct the diet. We have a dietitian on staff and a chef who's making delicious food. And the chef is teaching people how to cook, because you really can't sustain a healthy ketogenic diet if you can't cook. You're not going to be able to order all this food in a restaurant or by takeout. You really need to be able to make some food. And many people don't know how to cook these days. So we are teaching people how to cook and how to cook delicious ketogenic food and all the other things they need to know to be able to sustain all this when they get back home.
Fantastic. Listen, if people were struggling just with listening to this, struggling with mental health, you've given us so much to think about. What would be the first steps that you would suggest for them to do if they were just wanting to help themselves?
Yeah, well, it depends on what they're struggling with. I mean, let's say it's someone who's having some mild to moderate depression and some anxiety, maybe a little insomnia. I think some version of what I'm describing, it'd be hard to do all of that all on one's own, when they're already struggling, but maybe start with diet. Cause I think that's, in some ways the most powerful. Try to remove some of the ultra processed food, get rid of the extra sugars and these processed oils, eat a whole foods diet. And then, next step might be lower carbohydrates. Can you start removing the bread and rice and pasta and starchy vegetables? And then, add in some exercise. You might add in, with a lot of my outpatients before I started Accord, trying to do this as user-friendly as possible. Sometimes I would have people do some time-restricted eating, and that's another way to jumpstart metabolism, have the body start making some ketones. I've sometimes used this product called MCT oil. Do you know about that?
Yes. Yeah. Go on. But share it with our listener.
Yeah. So
I know what it is.
Medium chain triglyceride oil. It's derived from coconut oil. Essentially, it's a refined coconut oil. And it's tasteless and odorless, but it's very, very ketogenic. So that oil goes directly from the gut through the portal vein to the liver. And as long as someone hasn't had a big carbohydrate meal recently with a lot of insulin on board, the liver will turn almost all of those MCT molecules into ketones. And so it's a way to get some ketones. So if someone, let's say, stops eating at 8 p.m., they wake up and I tell them, let's try to fast until noon. Let's try to do a 16-hour fast here. But when you wake up, have coffee with MCT oil and maybe a little bit of heavy cream in there. And that will keep your hunger away until noon, and you can have some lunch. And invariably, people will come back and say, what was that? That was amazing. That felt really good. And it's because their body started making some ketones from the MCT oil. And that usually gets people's attention. And then we can sort of start going from there. Okay, well, let's now lower the carbohydrates a little more. Let's add in the exercise component. Let's start getting those ketone levels up. Let's start measuring the ketones at that point. So, one can sort of gradually move themselves into this. And, as long as they're not taking heavy duty medications for mental health or diabetes or high blood pressure, it's a pretty safe thing to do. If they are taking medications like that, they should work with their medical professional to help them, because the ketogenic diet is actually so effective at lowering blood sugar, lowering blood pressure, that if someone's taking those types of medications, they could actually lower their blood sugar or blood pressure too much if they're in a ketogenic diet. Their underlying condition's going to get better. And so they won't need to be on such high doses of those medications, essentially. And many people will be able to get off their diabetes medications or their blood pressure medications. And same with psychiatric medications. I mean, often we we'll need to lower the doses of those. But again, that has to be done, in concert with a medical professional.
Yes, I know we've done a wonderful program which we might re-release with this one with Dr. Mark Horowitz, who was talking about titrating off antidepressants, and that is much easier said than done, even if one follows the recommended protocols.
Well,
is that your experience too?
Yes, absolutely. I mean, Dr. Horowitz is amazing for the work he's done. The recommendations unfortunately haven't caught up to his work. So most doctors are still out there tapering people off these medications very quickly and not appreciating how much of a withdrawal syndrome there is. And it's not just from antidepressants. Every single psychiatric medication has a withdrawal syndrome. And that's also not appreciated by many of the psychiatrists out in the world. And, it wasn't appreciated by me as well when I was a younger doctor too. We would take people off of, they were on let's say a mood stabilizing medication and we want to switch them to a different one. We would just take them off the one and put them on the other one and not even think about the withdrawal syndrome they were having from the first one. But absolutely that there's good data that there's withdrawal syndromes for all of them. And I've seen it now in, once you're paying attention, you see it when people are coming off, and you need to go very, very slowly, similar to what Dr. Horowitz recommends. They're often talking about, 10% reductions per month, which means, that's parabolic. So, each time you're reducing by even less. For many people, they do need that slow of a titration. Not everyone. I've definitely had people come off quicker than that, who tolerate it fine. It seems to be an individual thing that some people are more sensitive to these withdrawal symptoms than others, but they really do exist with all these medications.
But when we say quicker, some people might take 8 weeks to 12 weeks and others might take 1 to 2 years. Would that be a fair range?
That is a fair range, although I have seen people come off even quicker than that without problems, but it depends on how long they've been on the medication. I mean, if someone's been on it for, 15 or 20 years, the quickest it would absolutely would be 2 or 3 months to come off, but usually much longer than that. Whereas if someone's only been on the medication for, let's say, 6 months or a year, you may be able to come off in, a month without a problem.
Matt, it's been so good talking to you, and what you're doing is so exciting. I wondered if we might just finish now, and I want to take a step back from your role as a psychiatrist and leading these initiatives, because we are all individuals on a health journey through this modern world. What do you think the biggest challenge is for us as individuals on that journey?
Well, I mean, I do resonate with how hard it is to take care of one's health in our modern world. I sympathize with people who say, well, I just can't, I don't have the energy to do all those things that, that I've been talking about today, or that other people might be talking about. I'm struggling just to, pay my bills and get to work and take care of my other responsibilities. I just can't do all those things. So I do resonate with that. And I think there's a reality to how hard it is. And, our food system makes it very, very hard to do, to eat in any kind of healthy way, let alone what I'm talking about, which is even more challenging. But I think the message that I would give people is that if you go through some effort, you can create energy, literally, to do more. That if you can just turn the corner and just put some effort into doing the right things. And some of these things don't take a lot of time or effort. Getting up and getting sunlight in the morning is not that hard. You can just, whatever you were going to do anyway in the morning, you're going to read the paper or your phone or whatever, just go outside and do it when you first wake up. Take a walk when you first wake up. That's not that hard. And so if you start doing some of these little things, you start getting some benefits, you're creating energy to do more of these things. And eventually, you become, a really healthy person if you keep taking step by step like that. And it's amazing what the difference is between, truly feeling vibrant and healthy and vital compared to just sort of living. I know the difference myself because, I went through my own health journey. Once our kids were getting better and I learned about all this, I did it on myself first. I was my first subject. And believe me, I'm functioning at quite a different level than I was, 5 or 6 years ago. I'm like a different person.
Well, listen, what a great note for us to finish on, and what a great message for us to finish on. And I want to thank you not only for all the work you are doing and the initiatives you are taking, but for sharing your knowledge and wisdom with us today. So thank you so much.
It's really been my pleasure. Thanks for having me.
What a great episode. What a great discussion. How inspiring, how exciting to see a psychiatrist literally turn the world of psychiatry on its head, and coming up with such a holistic approach. I loved his 7 steps: brain insulin, control mitochondrial function, reducing inflammation. I mean, we've talked about inflammation in so many different ways. It's the common denominator in all diseases, both physical and mental. The reduction of oxidative stress. He talked about GABA, G-A-B-A, and glutamate, and brain-derived neurotropic factor. Brain-derived neurotropic factor, yes, BDNF, and of course the gut-brain connection, which we've talked about many times. Now, I love also the fact that not only is it diet, not only is it exercise, not only is it mindfulness, but it is also about circadian alignment. And we need to take that seriously too. Look, we'll have connections to Accord, which is Matt's great initiative. And his website. So I hope you enjoyed this conversation. Until next time, this is Dr. Ron Ehrlich. Be well. Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness. From self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.